All right. I'm just going to start. I want to welcome you to Amundsen High School to something that I think is really a one-of-a-kind initiative so far in the district, and I'm really hoping that more people become involved in these kinds of activities. I'll give you a little bit of background about what happened before we move into the panel and the activities, the Q&A. But this is our medical and mental health awareness panel. And this event tonight came about as part of my personal struggle about what to do relative to student safety. Are we returning to school? Should kids get home through remote learning? And so as time went on and little by little students started coming back to school, I started noticing some things that were very different about the kids when they returned. And so as we started thinking about COVID mitigation, particularly when kids were all coming back at the same time, those were really important questions. And how do kids keep kids safe in an environment where the traditional mitigation structures were not necessarily able to be maintained, 3 feet distance. You can't put 1,500 kids run around and say, hey, 3 feet apart, 3 feet apart. But what we noticed were that the issues that students were facing were much more significant than the medical challenges that were being documented. And so after January happened and teachers left for a while because they wanted to make sure schools were safe, and then we started thinking about masks, and we started thinking about all of these other different mitigations changing as there was some perception that things were improving with COVID. The thing that didn't change as cases dropped. The thing that didn't change was the mental, social, emotional impact on students that we saw. In numbers greater than ever before, exponentially greater than ever before, students were presenting with mental, social, emotional health issues that we had not seen in students who, up through the first 10 years of their lives, or 10 school years of their lives, presented with no problems. And as part of that exponential increase came an exponential increase of anxiety among parents who were calling us and saying, help us. And as part of that, there was an exponential increase in crisis of teachers who were going through their own fears and anxieties about what to do in this very crowded environment. What was not an exponential increase were the services that were provided and that were available for kids. Getting an appointment with a therapist, with a licensed clinical social worker, with a hospital for even the most severe cases was incredibly difficult, if not impossible, to navigate. And so we wanted to address what we think is the real long COVID. The long COVID are the social, emotional, and mental I don't want to characterize it too negatively, but long-term effects that our students may face. In addition to that, the world started noticing. My cousins who are teachers in Montenegro, my friends who are teachers in Serbia said we're seeing the same thing. Our students are having the same experiences. But what's different here is that we have a level of accessibility and knowledge and access and an openness to talk about social, emotional, and mental health that many countries are not prepared to do. And so, one day I was having a crisis of conscience in my office, and I said, we need to do something to not eliminate any conversations about the physical impact of COVID. Those are incredibly important conversations. But we needed to do more to promote the other aspects of COVID that students were experiencing. The things that people don't necessarily want to talk about. The things that people are afraid to talk about because they don't know how to address them. Frankly, we got to a point where we didn't know how to help people anymore. I do know 38 years I've been doing this. I've been a principal for 10 years. And I've always been able to point the parents at least in a direction. This is the first time that we were so besieged by cases with no real resources and outlets for support that we said we need to turn to people who may know. So I sent out an email to parents, if you're my parents, you got it, that said if you're in the medical or mental health field or adjacent to medical or mental health fields, fill out this Google form. I didn't explain what it was other than to say, I'm trying to think of ways to support students. And the reason I didn't explain it is because I didn't know what we were going to do. I needed these people to come to the table. And so about 40 parents answered. Everything from paramedics, to psychiatrists, to nurses, to medical doctors were writing to say, hey, we're here, what do you need, what is this? And I said, I don't know yet, psychologists, just come and let's sit down and talk about it. So we had an opportunity to explain some of the things that we were seeing that were unprecedented. Instances of cutting, instances of cutting, instances of school avoidance, instances of depression, anxiety, kids bursting out in class, crying in class, having outbursts, and we couldn't really make the connection why. So all of these people, of the 40 who responded, 35 came and have been consistently coming to meetings to think about a strategy that has numerous parts. And this is part one, this is the first step of the first strategy. And that is public communication, starting a conversation with community members, with our stakeholders, with our neighbors, with our friends, about what our kids are experiencing. The second strand or strategy is parents talking to parents. I have got a wealth, how lucky we are, of therapists, counselors, psychiatrists, nurses, who are parents who are willing to meet with other parents off-site and hold space for conversations about what they're all experiencing. And the third and the fourth strategies are tied together. How are we going to start promoting conversations with students, educating students, having conversations to help us to continue to normalize. I mean, stigmatize, I guess is the word, but it honestly we do okay. So to continue to normalize conversations about social, emotional, mental health, so that students are better advocates for themselves, and in Amundsen we say accountable, honorable, and scholarly, so that they're accountable for each other and that they exhibit honor in their interactions with others. And then part 4 that goes with that is education for staff, so that they know the signs and how to recognize them. So about 35 parents from medical and mental health and adjacent fields have been coming forward to develop this strategy. And so on May 19th, you're going to hear more about this. Across the street, off-site, are psychologists, licensed clinical social workers, nurses, and English and Spanish are going to hold space for parents to talk to parents. Rather than create an agenda, just what are you experiencing? The biggest thing we realized is that parents don't know where to turn. Even the most educated and informed parents in crisis freeze and say, I don't even know who to call. And then when you call it, you can't get through. So here's an opportunity for parents to communicate, and you know I'm going to say this to you 95 times, with each other, away from us, to make those connections and to build those bridges. For strategies for moving forward. Mental Health Week is coming, May 16th to 20th. This is Mental Health Month, Mental Health Awareness Month. We have a whole host of activities, which we'll outline for you later, but that normalize those conversations again, creating conversations about mental health, wellness, education, and self-advocacy. So for tonight, this is what, and then this is under development still, but it's gonna go live Friday. This is a list of resources that our 30 parents, 40 parents are putting together so that you can see information, events, activities, goals, strategies, community resources that parents can just go to and look at and reach out. So for tonight, here are our expectations and our norms. Openly share what you think no longer. There's going to be an opportunity for you to ask questions. Parents already submitted questions, okay? And we're not going to get to them all tonight. We are not solving or finishing this issue tonight. This is the first step in the first strategy of 4 strategies. We can continue to have these meetings and symposiums for parents to come together as we fine-tune what it is. Maybe we can have a specific conversation about a specific thing. Don't sacrifice the good for the perfect. This is not perfect. We've never done this. These professionals have done this all independently. We haven't practiced this. These are people who are surfacing the things that they are experiencing and here who they are in their fields. Listen to others without blame and judgment. There may be some questions that make you feel uncomfortable because they ring too close to truth, or because they're before the grace of God. And finally, be patient. This is a process. Don't have my manager expectations, and I'm really good. I've seen the slides, I know these people. But we're not going to resolve that with you tonight. So it's important for you just to be active listeners and to participate. Active listening means responding, when there's an opportunity. So I'm going to introduce the only non-mental medical health adjacent parent who showed up to meetings anyway and said, I'm a tech guy, but I want to know what this is about and I want to see how I can help. So tonight, Jim Kozlowski is our moderator and our tech person, and he is going to take us through the rest of the presentation because this is not our agreement. My agreement was this is not what I'm going to do or what my team is going to do. We will help you and we're here, but we really need this to be parent-led, and that's what you're going to see tonight. Thank you.
Thanks, Coach. Jim Kozlowski, glad to be here with you tonight. We've already gone through a bunch of the agenda with the introductions, but kind of to let you know what the format is. We're going to do some panelist presentations after I introduce the panel. And as Principal Pete kept saying, there's a lot more of us that have been meeting, but these are the professionals who have something that applies to the questions that many of you asked through the survey. And then we'll do some Q&A later tonight, too. So we got a little self-care session with some breathing, because you have to take care of yourself, to take care of your kids. So we all know that from being on the airplane, right, for a little speech. So you have to breathe first yourself. Sharing this deck by email, so there will be a link to a good article from the Washington Post that you can read if you like. I left this slide in here because of that, but the more I thought about it, we're here to build community, as the principal just said, because although we're not sure what any of the specific answers are to these really difficult questions, we know what the answer isn't, and it's isolation. So, and a lot of the stuff we're going to talk about tonight is really isolating, or it was in my house anyway. So, we really encourage you to reach out, make connections, and join us going forward at some of these other events. Okay, so this is the survey that we mentioned a few times that went out by email, and we harvested a bunch of questions. We tried to condense them so that we can answer as many as possible tonight, but we will not get to them all. And these were the results. you can see the biggest one, that big blue bar in the middle was mental health challenges. So, to the principal's point, that's what most of you are concerned about. So am I. I'm an Amundsen parent too, by the way, besides working for CPS. The other, I think, I'm not certain, but I think the other category was when people type in questions. So that was a big leader as well. This is like the word cloud idea. People who type in questions, the biggest words are questions. That word got used the most. So you can see what we're focused on: school, kids, parents, health, support, teams. So I love these things. I'm a nerd for them. So thanks for your input, and we'll get to as many of these as we can. Okay, so here's the professionals on the panel. We've got Dr. Stephanie Black, and Dr. Dave Goldberg, Dr. Jim Clancy, Master's Qualified Nurse Angela Geshry, and Jim Kozowski, as I said. We've also got Lydia, counselor here, and some other Amundsen staff are over here to help us out. My qualifications, besides being an Amundsen parent, our freshman here is doing pretty well so far. We're really happy this year with a school that's doing so much forward thinking in this. The middle one is a freshman down in Champaign. He came back from winter break and got immediately put in a COVID positive dorm. So we got to experience that whole stress bag. And then the big one just is leaving tomorrow for Africa for his first Navy deployment. And he got kicked out of Jones. So I got a ton of experience before COVID. COVID wasn't even a thing yet. So we got a bag of issues at our house. I qualify. Good to be here with you. So I think with that, I'm going to get out of the way and let Dr. Stephanie take it away.
Right. Good evening. Thanks for having me here tonight. So I know really people don't want to talk about COVID, but I just wanted to start and provide some context about where we're at with COVID right now, and then share with you some data that has been conducted through surveys of adolescents that backs up all of our concerns. The data is there to support these stresses in mental health. And then lastly, I want to share with you some resources that are available through the city, newly funded sources. So really excited about that new campaign, which is called Unspoken. So I'll talk about that a little bit. And I did want to add that I have a freshman here at Amundsen, and I'm really happy that he's here. So, to start with, in terms of where is Chicago at with COVID, right now, the city and the CDC and the nation is basing where communities are at based on community levels. And that is measured based on the number of cases per 100,000, the number of COVID hospital admissions, and then the number of staff inpatient beds at the hospital. So the framework is supposed to capture the number of cases in the community, but also the burden on the healthcare system. And right now, we are at a low level due to all of those measures being sort of reasonable. We are heading right now to be into medium because of the case counts. We're seeing about 700 new cases a day of COVID in Chicago, which is right around 180 per 100,000. And we're just getting close to that 200 mark. And it's at the point of being at medium that we're really encouraging people to wear masks when they're in indoor gatherings. And so, why we make some comments tonight, just because we believe in a couple of days we'll be in that medium range. Now, when we if hopefully we will not get to into the high range. That would be if there are a high number of cases and we also see an impact on the healthcare system in terms of hospitalizations and deaths. If we get to a high level, that is the point at which we would see again the need for mask mandates and doing vaccination checks at places. But in the medium level, we are going to encourage, and if you want that stopgap, we'll be encouraging people to mask. If you're around people who are compromised, etc., encouraging masks. And so right now, I just really want to emphasize again that we're nearing medium community transmission, and that we strongly encourage masking if you're in an indoor setting, people who don't know their vaccination status, and then also if you are exposed to a person with COVID, regardless of your vaccination status, that you should mask for the subsequent 10 days after that. Okay, you can go to the next slide. This is our dashboard. If you're not familiar with it, the link is there, and you can check it out, where we post the number of cases and the hospitalizations and deaths, which are those primary factors that we're following now. And the numbers are presented a little bit differently, but you can play around with the site and get to the area where you see that meter. But I do want to point out that this slope, like our rise in cases that we're seeing right now, is very different than what we saw in December, where we saw that Omicron surge. We shot up in cases in a matter of days, really weeks. This is a very slow kind of creep up, and there's a disassociation of the number of cases with the number of hospitalizations and deaths, like a decoupling of that. So I really want to kind of see, like, we got a lot of COVID. There's a lot, people who didn't have COVID, like I know a bunch of people now are finally getting it. So it's out there. There's a lot of it around, but we're in a better place than we were last time. So the next slide is again the sort of right for health. So the data that I'm about to show you was published in the Washington Post under this story. And what the survey was called the Adolescent Behaviors and Experiences Survey. And this was conducted from January to June of 2021 among 128 public and private school high school students. This was like a 110-item questionnaire, and over 7,705 responses were submitted, and that's where this data comes from. And so from those students, it was determined that 55% had experienced emotional abuse from a parent or a home care provider. It was defined as how often did a parent or other adult in your home swear at you, insult you, or put you down. And then 66% thought the schoolwork was more difficult during the pandemic than before it started. And then also 10% reported physical abuse that was defined as that a parent or other adult in your home hit, or physically hurt you in any way. And that's obviously distressing for all of us. And on the next slide, gay, lesbian, or bisexual students experience consistently higher percent of stress, which is shown in the blue, and those who were kind of deciding where they were at with it in the light blue, compared to heterosexual peers that are in the lightest color blue. So in every category, parent job stress, student job loss, hunger, homelessness, you can see on the slide, each of those stressors was really greater for kids who were dealing with issues around sexual identity. And so I want to say that the report concluded, and this is why we're here tonight really, that compared with those who did not feel close to persons at school, students who felt close to persons at school or in their community had consistently less feelings of sadness or hopelessness or suicidal thoughts. So the connection to community is essential for these kids. And so I just want to wrap up, talking about this, new website that the city has, and this is a big deal. Dr. already talked about it in our Facebook Live today, because it's Mental Health Awareness Month, as been talked about. And so I urge you to check out this website. There are resources, newly available resources, including for teens that going to find mental health support will be able to find. And the title Unspoken was really chosen purposefully because of the, confronting the stigma around mental health and really encouraging people to tell their stories and to be good listeners and mostly to make connections. This is, if you do click on that Find Mental Health Support, you'll get to, there's a map and you can pull up the balloons there and it has the contact information and every resource listed on the website, they will take people who do not have insurance. That is the only way they were able to get onto their website. And so I will turn it back to Jim.
Thanks, Dr. Stefan. Appreciate that. It's really good to hear about that new resource. We can look at it online. I did not know about that. So next up, we've got Dr. David Goldberg. Take it away, Dave.
Hi, everybody. I'm a child psychiatrist and work in the neighborhood, and I have a junior here, and really happy to be here. When I was invited to come be on an expert panel, I kind of laughed because none of us is really an expert in doing pandemics. But on the other hand, we are kind of expert because as we, the 35 or whatever it was of us parents got together, we realized that practically all of us have kids that have gone through really rough times. And what was really helpful is hearing each other out, having this kind of community that's forming thanks to someone around here. An amazing woman who keeps this show going. And so what I'm going to try and talk about is a little bit more the emotional side of these numbers. Basically, there's a lot of words, but in the fall last year, there was a mental health crisis, a state of emergency declared, which I think is almost like so horrible to think about for our own kids, particularly. You hear about suicides, and it's one thing to see statistics, hear about numbers, but it cuts really close at home when you start to know the families and the schools. And to think that the numbers were already increasing before the pandemic, and now they're accelerating, we don't really know. We're too close to it. You can go to the next one. We're kind of too close to it still. We're in the middle of it to be able to see the forest through the trees. But luckily, kids are very resilient. And even kids with really serious problems, most are going to grow up and come out okay. A big part of what can help them to get through it is how we as parents and teachers, counselors, how we adults are taking care of ourselves. Because that gets transmitted in ways that are not so obvious sometimes, that kids pick up on. And so coming together, I think that song, this is high school, but I think that the more we get together, the happier we'll be from the most important year of school, preschool. It's really true. We're social beings, and that helps us modulate, regulate our own nervous systems and our stress, so we can show up for our kids. It's always looking into the tree that's being blown, and the pandemic has definitely given us a stressor. It's so big, so global. At the same time, everyone in the world is dealing with it at once, and microscopic at the same time. This unseeable but breathable threat. It's really been something, and I'm not telling you something you don't know, but I think I might be reminding you of some things that you don't really want to think about, that we can put out of our heads. We're all in the same storm, but we're not all in the same boat. So the next slide. Just wanted to say one more thing about behind the adversity, there's always a silver lining. And one of the silver linings, of course, is we're talking about mental health. When was the last time you were at something like this to talk about mental health? And we've been on college tours that I go and see on all these college tours. There's posters about groups and mental health. That didn't exist, you know. I mean, the generation of our kids now, a lot of kids take medicine, it's destigmatized, you can talk about it, but now it's even more in our faces, which is going to be interesting. And I think the healthy and helpful thing, of course, there's always a downside. But sticking with the silver linings, telehealth, you know, being able to instantaneously start a session, if you can find a therapist and reach out, that's kind of been a godsend for flexibility, of course, during all the remote stuff too. It was important. And there's also signs of more funding coming locally. We might hear a little bit more about that later, because that's always a challenge in mental health. I'm not going to go into details about the mental disorders and other criteria to diagnose them. This AACP site, for the American Academy of Child and Adolescent Psychiatry, is helpful. There's a lot of information there. And one of the things that they do talk about that I think we should discuss is risk factors for suicide in kids. And it's kind of like when you think about what depression, the signs of depression are, when you see someone whose eating or sleeping habits have changed, the pervasive sadness, a change in personality, you know, much more irritable, much more solitary, isolative, and sometimes just before a suicide attempt, there can be improvement where the kid suddenly seems very light and better. So that's something to consider also. Drug or alcohol use really increase the risk. Self-harm is not necessarily indicative of imminent suicide, but it is associated with an increased risk. And kids who are talking about or researching ways to die, big red flag. The site goes on to say, when you have a child who's at risk, showing some of these signs, they should be evaluated immediately by a qualified healthcare professional. Well, it's really not that easy to find someone. The ER is available, but I don't know if you've been in an ER emergency room. I just was talking with a kid who was in for about 4 days, sleeping, living in the ER, waiting for an inpatient psych bed, because even before the pandemic, there was a huge shortage. There's not enough beds. And so, you know, God bless the ER got sort of dealing with COVID and worried about, you know, taking care of themselves and getting home safely. Then they have kids who are living right there, difficult teenagers sometimes, you know, with multiple problems, and having them all in the same room is really pretty crazy. So we need to ask for help when we're feeling overwhelmed. I think we need to teach our kids that too, and probably we're going to end up teaching our kids to help each other. And there are programs training kids to identify other kids at risk and teaching them what to do. And that is probably going to be necessary and important, because I don't know if you've tried to find a therapist for yourself or your child lately, but everybody has super long waiting lists. A lot of therapists are burnt out or retiring, switching fields. I know one, she's moving to another state, she's going to go work at REI. She wants to do retail, you know. And it's like self-care that's important, so I respect that. But it's kind of frightening. So my main message is reach out, don't worry alone. If you do fear for your child's safety, call someone for help. Monitor them closely and maybe call a trusted friend. A family member, an hotline, or a clinician therapist if you have one. And go to the ER if necessary. That can be a place to contain a person, a young person, temporarily. Sometimes the crisis will pass and they'll be discharged home. Sometimes the very next day, right back to school, and then the principal is like, "What? This kid was suicidal yesterday." Was telling us about cases. So that happens, and it's not a perfect system. Our healthcare system is broken, and it was broken before all of this, but now it's really being stressed, especially the mental health side of it. The other thing good about the ER is they can be prepared for medical problems that might mimic or be exacerbating what's going on, and so that's really important. Also, prevention and planning, seeking out help proactively before you actually need it, makes a lot of sense now. If you see your kids starting to show signs of stress, it's time to start trying to assemble a team. That could be a pediatrician, family doctor, trusted others, and hopefully you can find a therapist. It's not easy, but keep trying. And Angela's going to talk about a very helpful list of resources soon. But it's easy to get discouraged when we get triggered because we're afraid for our kids. And then sometimes the shame can kick in. We can start blaming ourselves very easily. I think we're all experts in that at times, but that really gets in the way. And especially now, it really takes a village to raise a kid and keep them safe. I'm going to go quickly through these causes of mental illness. There are some genetics, but it didn't really turn out to be as simple as we hoped with the genomic revolution. We're able to pretty quickly have machines that can give someone's entire genome. We're hoping that we can diagnose psychiatric disorders, but it's not quite that simple. We're a long way from being able to do that. Parents don't cause mental illness. We all feel like, or secretly fear that we cause their problems, but we don't. We can transmit stress and problems, and I'm going to talk about that a little bit more. But we're not the cause of it. Adversity, trauma, homelessness, poverty, stress. A lot of people were unable to work or lost their jobs, and that affected men morale or self-esteem, and can get acted out with violence. We saw some of those numbers. So those things create generations of mental illness or exacerbate them. Bullying is another one. Discrimination. And so we're all in the same storm, but not in the same boat. So people of color and people with less resources have really been suffering much more. We know, the actual infection rates and deaths, but also the mental health sequelae. So part of what helps us is coming together as social beings, which is why I'm so thankful to Ms. P for getting us all here and talking. We're going to take some questions, so I think that's important to have more of a conversation. So this is mine. It takes a village to raise a child. Set of slides. We're all affected, and we want to blame someone sometimes. Get angry, we're scared. We see these road rage numbers going up, shootings, homicides, and bullying. So I want to switch a little bit gears to the next slide and talk briefly about Elizabeth Kubler-Ross. A lot of you probably know the Swiss psychiatrist who, she was sick as a child, watched a child die when she was like 5 or 6 years old, and dedicated herself to studying death and dying. Came here to the University of Chicago in 1969 and wrote this book on death and dying, helped establish palliative care, hospice, and got people talking about death. well, this is not really a theory, and it's definitely not a prescription of how you should grieve. There is no correct way to grieve, but it's a description and kind of can help us understand and give us a framework to think about what we and our kids are going through as we are grieving. So the next slide. No, back one.
Back one?
Yeah. Even before the pandemic arrived, there was an unsettling blurring of boundaries, between generations. Who's in charge? Who's going to keep us safe? There's so much change going on. I'm not just talking about the political stuff, but this really got worse for us with the loss of face-to-face connection. That's so important for a sense of safety at a pre-verbal, non-verbal level. Physical presence, the loss of a sense of safety in our very homes and in public spaces we used to take for granted. So the loss was universal around the world, like I was saying, at the same time, and it's cumulative over months and years. Even if you haven't lost a loved one to COVID, we are all grieving. And some high schoolers are grieving their childhoods, their sense of an ideal, safe world. They might be angry about it. Everyone has to emerge from the dream of childhood sometimes, but how would you like to emerge from the dream of your childhood into this climate change and now war, inflation? My daughter talks about this, like, I'm so mad at you. Are you kidding? So the next, you've probably seen these 5 stages, and I'm not going to go into detail, but you'll recognize some of this. Like the initial one, I was like, this isn't really going to spread to the whole world at once. Can't be. There's so much uncertainty. I don't really have to worry about any of the statistics because no one's going to ever know for sure. These are some of the ways I was thinking about it. So that all happens when reality is just too painful to take in, and it's an automatic, necessary way of getting through difficult times. And then sometimes it can pass into anger. And we go through these stages in different orders. We go back and forth. We get to acceptance and we slip back and are angry again. Anger kind of feels satisfying a little bit. When someone cuts you off on the road, it's easy to blame. It's that guy's fault. And we're blaming them for all kinds of stuff. It's not logical. But if we stay in the anger, it can damage relationships. We've spent a long time developing. If we avoid getting stuck and we can recognize our feelings, maybe talk about them, as we make sense of our loss, anger can provide an anchor or a focal point for our emotions and relieve the nothingness of denial, the despair of depression. Anger indicates the intensity of what we've lost. Bargaining is like, you go to the next slide. Bargaining is like, what if only I just wear my mask, then this will go away. That might be helpful. But you might also think, if I can control anything, I don't go to school, I turn my camera off during remote learning, maybe I'll feel better. I won't feel so nervous. Not really, then you're more isolated. Maybe if I quit my job, I'll feel better. It's not necessarily true. I don't know if that's what's behind the great resignation. But it's not really helpful to blame ourselves or others. And bargaining can be kind of a struggle to find meaning in what's going on. The depression part, I don't think I need to tell you, because I think we've all been going through that, where it just feels like it's never going to end. And next time, there's a lack of enthusiasm, there's hopelessness. It's kind of a way of accepting what's happening, but with really negative feelings. But then, if we are able to not get stuck in depression and move into acceptance, sometimes, and hopefully more and more. Our emotional attachment starts to wane, we can become more objective. And you can have a sense of calm and probably be able to show up more for your loved ones and your kids. But we're all bouncing back and forth, we're only human between all these stages all the time. The next slide is, kind of want to point out that when our school counselors have oversized caseloads, and everybody does in every school, probably all over the world right now, and this part of the world's probably better than many, it's almost impossible for a school psychologist to adequately meet the kids' needs. And mental health, both of the counselors and kids, is directly related to how we can learn and care for each other. So when people are really struggling with anxiety, depression, or trauma, they're not going to have the bandwidth to process academic information. And we sometimes have to adjust our expectations and realize, grades are not life and death. You might have a really bad year academically, but the priority is going to be health and survival. So we can help our kids by showing up like we are here tonight. We're volunteering at the school, asking for help, offering a word of support or recognition to teachers and counselors. Maybe you have a resource in your home or your community, in your church, that you could share with others, with the counselors here, or with other people tonight. One of the things that got lost with remote learning is, in schools, is usually a person, it could be a security guard, or not necessarily a teacher, but they can see kids that suddenly are disheveled, or bruised, and they identify this kid needs some help, and so we kind of lost that. That might partly be why kids were not getting flagged, the ones who were in more violent homes, and that might account for part of some of the rates going up. People probably want to know what we can do. As parents, we can encourage a healthy relationship with social media, and one of the ways, it doesn't really work to take the phone away, at least not in my house. And this is obviously a family by family. You decide what's right for your family, but some experts suggest sitting and watching with your kids, looking at social media, getting them to talk about it, think critically about it, rather than just forgetting about it. And what do we do about the kids that don't really want any help, don't want to admit there's a problem, or maybe don't want to go to school? This is really difficult. I don't have easy answers. But to talk a little bit about school refusal, we're all connected. So when one person in the family system is really troubled or depressed, the other person who might be coming in as the identified patient, or the child might be seen as depressed, but until the parent gets treated, sometimes the kid won't be better. In school refusing kids, there's an increased risk of anxiety, panic, agoraphobia, fear of going outside, and depression in the parents. And the parents have trouble with giving just brief, calm, firm responses or limit setting. They have trouble tolerating the kids' distress. And generally for school refusal, most of us know the main thing recommended is as soon as possible, get the kid back to school. Any means necessary, but in these times, I think we have to be really cautious and careful about what we try. And there are kids who end up getting homeschooled, but that's really a last resort we want to avoid. These things on the next slide are things we can think about doing to help kids with anxiety too, in general, not just school refusal. Modeling how we take care of ourselves and cope and relax. Talk about problems, talk about feelings without judging. And the 4 cornerstones of health, we're going to hear a little bit more about, but is, healthy eating when we're hungry, getting enough sleep, doing daily exercise that's fun and makes you sweat a little and getting out and socializing. Empathize with your kids by listening carefully and then naming and validating feelings. And avoid judging and shaming. Shaming really gets in the way. It thrives in the dark when we don't notice it in ourselves. We don't name it. I really can't listen to my kids when I am starting to think, oh, I'm the worst parent. I'm a child psychiatrist, and my kid is doing this or talking about that. And usually, when I'm thinking that, I'm usually about to say something that I'm going to regret. It's going to go sideways. And I've been in a men's personal growth group for about 5 years. And in that place, it's a safe place where men can notice how they feel, pay attention to that, ask for help, which is kind of a foreign concept for most of us men, and then receive it, and practice responding with care to others. And I know when I open up there, I'm much less likely to have my feelings coming out sideways and hurting one of my kids or my wife in some way. So taking care of ourselves is so important, and I've learned that I'm becoming an expert in that. Our mental health is really linked closely to our physical health, and Dr. Jim Clancy is now going to talk more about wellness in kids and about some more of the medical issues.
Do you mind talking about the where the home instruction letter? I don't understand that.
About what?
Yeah, the where the home instruction letter request.
How about we save it for the questions? Because
It's in there. It's in there, right? Is it in there?
I'll make sure it is.
Yep.
So Dr. Jim Clancy's up next, and he's going to give us some medical stuff.
Thanks, guys. I'm a family physician in private practice on the north side of Chicago. Dr. Park, I've been practicing for about 20 some odd years, and I've known Ms. P for about that long. I don't think that's anything but my relation.
It's a doctor. Yeah, this kid goes to school here.
And my kid, a freshman who enjoys actually school very much. And I just want to say thanks for everybody for being here, taking the time out for this. This is important information, whether you're here in person or virtually. And thanks, Ms. P, for organizing this and to the panelists. It does take time to do this, and we are pretty, a little busy in the field, definitely. So I'm going to talk a little bit about, the well adolescent visit. And this is something that we usually recommend doing once a year. I hope everybody's getting their kiddo in to see either their pediatrician, family doc, nurse practitioner, whoever it is, on a yearly basis. It gives us an opportunity to identify and screen for all kinds of different issues, both medically and mental issues also, and emotional issues. So I would ask that you bring your kiddo in at least yearly to see us. I'm going to just talk about a couple of points in regards to this particular visit that's pertinent. Make sure that your kiddo likes their doctor. It's pretty important. It's like any other relationship. If there's a connection there, they're much more likely to be forthcoming with any issues and be more open and honest. And leading into that is, if you come with your kiddo, which I hope you do, it's important for you to voice your concerns. Any concerns that you have about them, we want to know about it, of course. But once you do that, I'm going to kindly ask you to leave the room. And again, the purpose of that is so that we can establish a sort of a trust in a relationship in a non-judgmental environment. And again, kiddos are going to be much more open and honest if you're talking about sensitive issues without the parents sitting there, gleaning at them in regards to some of these questions that we asked. So screening recommendations in counseling. We are going to talk to them about tobacco, alcohol, drug use, sexual activity. Again, we're going to assess them for this stuff, and then we're going to counsel them also. And we hope that you are on point with us in regards to, these are not great ways of coping with stress and our emotions, right? So that's important. We are going to talk about sexual health and sexually transmitted infections. Depending on the study, roughly 40 to 50% of high schoolers are sexually active. So if you've got 2 in high school, that means 1 of them are sexually active, basically. So, interesting statistic. And then we're also going to formally screen for mental health problems. We typically use a screening tool called a PHQ-9, which is a patient health questionnaire with 9 questions that they can answer, and that's got pretty good sensitivity and specificity for, in particular, for depression. And a score of basically a 10 or more is cause for concern, or if there's any suicidal ideations. Okay. Next slide, Jim. So we're going to ask them about their eating habits, of course, right? I mean, how often do you go to McDonald's? You know, for these kiddos, sometimes it's daily. Not the best form of nutrition, right? And nutrition affects us both physically, mentally, and emotionally. So we're going to talk to them about, reducing sugary beverages and fast foods, and some healthy snacks are really important. Some examples of some of the things you can do. I like, getting the kids involved in the kitchen and cooking is actually can be really, really helpful and inspiring. It doesn't always work well, but I would definitely try to encourage them to do that. A good resource tool is called website is myplate.gov. It's pretty simple, basic. Basically, is on the principle that you take a plate, you divide it into a pie, 4 pies, and the one is for protein, the other quarter is should be grains, healthy grains, and then the other 2 is fruits and vegetables. It's sort of a quick way to know how much of each nutrient you should be getting on a daily basis. Next slide. Okay, so exercise, and I know David mentioned exercise being very important, and it is not only for physical health, but there's many studies that demonstrate positive effects on mental health with exercise. Currently, our guidelines are you should be exercising about 60 minutes a day as a kiddo. I mean, that holds true for adults too, just so that's something that we're going to talk to them about, see how much they are doing in terms of exercise, and really counsel them on trying to get more exercise. And sometimes you have to be creative in regards to that, to pull them away from those electronic devices. But that's something that we want to make sure that they're moving. You got to move. Next slide. Sleep, and David talked a little bit about this too. Sleep is really, really, really important, very critical in regards to both physical health and mental health, right? So, as you can see, the statistics, 7 out of 10 high schoolers don't get enough sleep. My kid over there, he gets about 6 or 7 hours, and I told him, you gotta get 8 to 10, right? And so, when you do what you can to try to get them that way, they're going to be healthier, they're going to be happier cognitively, they're going to perform better if they get 8 to 10 hours of sleep. Next slide. So these are some of the safety recommendations that we discussed with like them. I mean, we don't discuss everything, of course, but I like to highlight the social safety recommendations. We want to monitor their internet use. Kids think about a kid in a candy store, right? How are they going to self-regulate? It's very difficult. So you need to kind of be there and sort of keep a watchful eye out. We're going to ask you about bullying, and then counsel them if they are being bullied or if they are bullied. Of course, that happens. One thing that's really important for parents is to know your kids' friends. That's really, really critical, is to ask about them and know them. Who are they associated with, and how they know those girls too. And of course, peer pressure. It may not be the same type of peer pressure that we experience as kids growing up, but it can be equally damaging. So that's something we'll talk about, assess, and discuss. It's a very peer pressure. So next slide. Let's go. This is vaccines. Not to say it's not important, but so if you want to see the slides, vaccines are for next week. Okay, cool. So this is about adolescent self-care, which is of course very important. Things that we can encourage our kids to do, which can really help with mental health and physical health, of course, too. So there's lots of things out there that hopefully bring enjoy. I want to make sure they're doing that as long as it's safe, of course. And they should definitely look at that. I think that's very about where connection is key when it comes to health, physical, mental, emotional health. So we want to encourage them to connect, exercise, things like yoga, meditation, stand, really helpful for them also. And yeah, so this is self-care for parents, right? I mean, we always want to model for our kids, and so it's extremely important that we take time to take care of ourselves. Like the example I think you mentioned it earlier in the talk, when you're in a plane, the flight attendant is going over some safety precautions to say cabin pressure changes and oxygen mask. Wow, you put yourself first, and then you put your kid. Because you're doing oxygen in your brain. So the same thing applies in terms of self-care. You have to try to make it